Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Phenylketonuria, or PKU. Introduction. Phenylketonuria, or PKU, is an inherited disease. It can cause mental disabilities if not treated early and for life.
PKU is rare. PKU is more common in people whose ancestors were Native American or Northern European.
Babies are checked for PKU right when they are born. PKU is treated with a special diet. Without treatment, people with PKU may become mentally disabled.
This health education tutorial explains what PKU is. It discusses its causes, symptoms, diagnosis, and treatment. What is PKU? Our bodies need proteins to grow, make new cells, and repair tissues. Proteins are made of 20 building blocks called amino acids.
Protein comes from meat and eggs, fish, milk, beans, nuts. The body breaks protein down into amino acids. Any amino acids that are not needed are broken down and disposed of in the urine. One amino acid is called phenylalanine. People with PKU cannot process phenylalanine. If phenylalanine is not processed, it builds up in the blood. This buildup affects nerve cells, causing brain damage and mental disabilities.
Symptoms. Babies born with PKU act like any other baby for the first few months. If the PKU is not treated, they start losing interest in things when they are 3 to 6 months old. When kids with untreated PKU are 1 year old, it is obvious that they are not developing like they should. Children with untreated PKU have nerve and brain damage.
Untreated PKU can cause a buildup of phenylalanine in a child's breath, urine, and sweat. This can cause a foul smell, dry skin, rashes, or convulsions.
Kids with untreated PKU often have a small head called microcephaly.
The body processes phenylalanine into tyrosine, which produces melanin. Melanin causes darker skin and eyes. The body of kids with PKU cannot process phenylalanine into tyrosine. That is why children with untreated PKU usually have light skin and blue eyes. Luckily, problems from PKU are rare. Most babies born with PKU are diagnosed and treated early.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Causes.
PKU is inherited, which means children get it from their parents. But even if parents do not have PKU, their children could still have it.
Genes tell the body to build certain substances. Every person has thousands of genes. Our genes make us look the way we do. They also have something to do with our health. Each person has 23 pairs of chromosomes. Genes are found on the chromosomes. The gene linked to PKU is on chromosome 12. The gene on chromosome 12 makes PAH protein. PAH is what helps the body process phenylalanine into tyrosine. The PAH gene either works correctly or it is defective. We will call the good PAH gene that works correctly capital P. We'll call the defective PAH gene that does not work correctly lowercase p.
Everybody has 2 PAH genes, one from their father and one from their mother. If both PAH genes are defective P genes, the person has PKU. The good big P gene is stronger than the defective little p gene. Therefore, if a person has at least one big P gene, they will not have symptoms of PKU. A big P person does not have PKU at all. A big P little p person does not have PKU but carries the defective little p gene. This is a PKU carrier. A little p person has PKU.
When a couple has a baby, each parent gives one gene that is like their own for each trait the child will have. Which gene the baby gets from each parent is random. If both parents are double uppercase P, their child will not have PKU. Each parent can only give one PAH gene. If both parents are double lowercase p, their child will definitely have PKU. Each parent can only give one lowercase p gene. If one parent is double uppercase P and the other is uppercase lowercase p, their child has a 50% chance of being an uppercase lowercase p. Since an uppercase lowercase p is only a PKU carrier, they will never have a child that has symptoms of PKU. The double uppercase P parent will always give a good uppercase P gene.
If both parents are carriers, or PP, the child has a 25% chance of having PKU. The child has a 50% chance of being a carrier. The child has a 25% chance of neither being a carrier nor having PKU.
It's important to remember that each time this couple has a baby, there is the same chance of the baby having PKU. If a couple's first baby has a 25% chance of having PKU, any other babies they have will have the same chance. PKU Test.
All U.S. states and territories and many countries test babies for PKU before they leave the hospital.
A nurse pricks the baby's heel and gets a few drops of blood. The blood is tested for PKU as well as other genetic diseases. The PKU test is accurate if it is done when the baby is more than 24 hours old.
It is common for mothers and babies to leave the hospital soon after birth. This makes it necessary to do the test before the baby is 24 hours old. If this happens, healthcare providers usually recommend that the baby be tested again when he or she is 1 to 2 weeks old.
Babies born at home or somewhere besides a hospital need to be tested for PKU and other diseases. Treatment.
Mental disabilities can be prevented if a baby with PKU is started on treatment within the first 10 days of life. Treatment is a special diet that is low in phenylalanine and continues for life. The goal of PKU treatment is to keep the level of phenylalanine in the blood within a narrow range. The baby needs some phenylalanine to grow normally.
At first, the baby gets a special formula that contains protein but no phenylalanine. The baby can only have a little bit of breast milk or regular infant formula. A special dietitian helps parents know how much the baby can have.
As the baby grows, it can start eating solid foods at the same age as other children. The only difference is the food must be low in phenylalanine.
Later, the child can have certain vegetables, fruits, and grain products that are low in phenylalanine, but they should avoid high-protein foods.
Since protein is necessary to grow and develop, the child still needs to drink the special formula. It is high in protein but has little or no phenylalanine. People with PKU cannot have diet drinks or foods that contain aspartame. Aspartame is an artificial sweetener that has phenylalanine in it. It is usually called NutraSweet or Equal. People with PKU should continue being seen at a medical center or clinic that specializes in PKU. The diet for each person with PKU is different. It depends on how much phenylalanine they can tolerate, their age, weight, and other factors. Anyone with PKU needs their blood tested regularly for phenylalanine levels. The diet is adjusted according to blood levels. Babies with PKU need to be tested frequently for the first year of life. During childhood, it may not be as often.
Individuals with PKU must stay on a special diet through childhood and adolescence. Until the 1980s, healthcare providers thought children with PKU could stop the special diet around age 6, but high levels of phenylalanine in children and teenagers can cause learning disabilities. It is recommended to stay on the special diet for life. Working with a dietitian who has experience with PKU can help with planning meals that the whole family can enjoy.
In addition to diet, the FDA has approved a medication that helps with the breakdown of phenylalanine. This medication is Kuvan. It helps some patients lower their phenylalanine levels. The medication by itself is not sufficient to treat PKU. The patient needs to continue the strict diet outlined earlier. Tests to find the blood levels of phenylalanine are still needed.
Palynziq, pegvaliase PQ-PZ, is a medication that may help people who cannot control their blood phenylalanine levels with standard treatments. It is injected under the skin. Life-threatening allergic reactions have happened to some patients. For this reason, patients must complete a drug safety program to learn about the risks and side effects before starting Palynziq. Living with PKU can be challenging. Consider joining a PKU support group for encouragement and advice. Surrounding yourself with people who care can help you stay positive.
Maternal PKU.
There are some women with successfully treated PKU. Most of them stopped their special diet when they were children because at that time, healthcare providers believed it was safe.
Since these young women eat a normal diet, their phenylalanine levels are high. If they were to get pregnant, high levels of phenylalanine in the mother are bad for the fetus.
In up to 90% of cases where a pregnant mother has high levels of phenylalanine, the baby has a mental disability. Sometimes the baby also has a small head, heart defects, low birth weight, and characteristic facial features.
The PKU diet after birth cannot help brain damage caused by the mother's high phenylalanine levels during pregnancy. Brain damage due to maternal PKU cannot be reversed after birth. Brain damage caused by high phenylalanine levels in the mother can be prevented. The mother has to get back on the special diet at least 3 months before getting pregnant. She also has to stay on it during pregnancy. With phenylalanine levels under control, women with PKU can have a healthy baby. The pregnant mother needs weekly blood tests to make sure phenylalanine levels are not too high. If they are high, we know that the fetus's levels are usually 1.5 times as high as the mother's is.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Phenylketonuria, or PKU, is an inherited disease. It can cause mental disabilities if not treated early and for life. Our bodies need proteins to grow, make new cells, and repair tissues. The body breaks protein down into amino acids. Any amino acids that are not needed are broken down and disposed of in the urine. One amino acid is called phenylalanine. People with PKU cannot process phenylalanine. If phenylalanine is not processed, it builds up in the blood. This buildup affects nerve cells, causing brain damage and mental disabilities. Babies born with PKU act like any other baby for the first few months. If the PKU is not treated, they start losing interest in things when they are 3 to 6 months old. Children with untreated PKU have nerve and brain damage. Untreated PKU can cause a buildup of phenylalanine in a child's breath, urine, and sweat. This can cause a foul smell, dry skin, rashes, or convulsions. PKU is inherited, which means children get it from their parents. But even if parents do not have PKU, their children could still have it. Mental disabilities can be prevented if a baby with PKU is started on treatment within the first 10 days of life. Treatment is a special diet that is low in phenylalanine and continues for the life of the child. People with PKU should continue being seen at a medical center or clinic that specializes in PKU. The diet for each person with PKU is different. It depends on how much phenylalanine they can tolerate, their age, weight, and other factors.
Thank you for using Explain.